A lack of potassium can result in a number of health problems, including hypokalemia. Hypokalemia is characterized by an abnormally low potassium level in the blood, which can cause a variety of health complications, including muscle cramping, fatigue, bloating, and irregular heartbeats, amongst others. In today's video, we'll unveil 7 subtle but significant signs that might just be pointing to a potassium deficiency. Let's get started. Next time you are feeling a little too weak in your bones, it may not be your imagination, and you probably need some extra doses of potassium. Potassium is essential for regulating the body's acid-base pH balance. When potassium levels are low, the body may become more acidic, a condition called acidosis. To neutralize excess acid, the body may leach calcium, an essential mineral for bone strength from the bones. This process can weaken bones over time. Potassium also plays a role in the prevalence of osteoporosis. Though it mainly occurs at a higher age, bones lose their mass and become vulnerable. A study has shown that low potassium levels can disrupt bone mineral density and influence osteoporosis. In addition to that, potassium is essential for proper muscle function, including the muscles that support and protect the bones. Muscle weakness due to potassium deficiency can reduce the physical stress placed on bones during activities, potentially leading to decreased bone density over time. However, one can maintain strong and healthy bones more easily by taking a proper diet with enriched potassium. Foods like bananas, oranges, and leafy greens are rich sources of potassium and can contribute to optimal bone health. Although tingling is more common in people with high potassium levels, which is known as hyperkalemia, potassium deficiency may also influence tingling or numbness in various parts of the body. We have previously discussed how potassium ions play a crucial role in maintaining the resting membrane potential of neurons. That's why it becomes an essential element for the initiation and propagation of nerve impulses. When potassium levels are too low in the blood, a tingling condition called paresthesia can be seen in the hands, arms, and legs. It mainly happens due to disruptions in nerve signals. Correcting the potassium imbalance through dietary changes or supplementation may often alleviate these neurological symptoms and restore normal nerve function. It is crucial to seek medical attention right away in cases of severe potassium deficiency, especially when other neurological symptoms like muscle weakness or heart palpitations are present. That persistent leg cramp or weak grip might not be a random annoyance. It could be your body's way of signaling low potassium levels. Scientific research confirms that a potassium deficiency can have a noticeable impact on your muscle strength. One of the primary ways potassium influences muscle strength is through its involvement in muscle contraction. Muscle cells rely on a delicate balance of potassium and sodium ions to generate electrical impulses. When potassium levels are too low, this balance is disrupted, affecting the muscle's ability to contract efficiently. Moreover, potassium helps regulate the neuromuscular system as nerve cells communicate with muscle cells to initiate muscle contractions with the help of this mineral. Inadequate potassium levels can hinder the transmission of nerve signals to muscles, resulting in reduced muscle strength and coordination. Several studies have investigated the link between potassium deficiency and muscle weakness. One notable study found that low potassium levels in muscle cells impaired muscle function, leading to weakness and decreased endurance. Hence, it's true that potassium deficiency affects muscle strength by disrupting the balance of ions needed for muscle contractions and impairing nerve-muscle communication. That's why ensuring a balanced diet rich in potassium-filled foods like bananas, oranges, and potatoes can help prevent these detrimental effects on muscle strength. Do you feel stiffness in your muscles regularly? Does your condition improve after taking calcium? Well, if the answer is no, the real reason behind muscle stiffness might be potassium deficiency, which goes unnoticed very frequently. Potassium deficiency can have a significant impact on muscle health, leading to muscle aches and stiffness, primarily due to its role in muscle function and the complex mechanisms involved in muscle contraction and relaxation. To state it more clearly, potassium deficiency can influence muscle aches and stiffness by disrupting the normal resting membrane potential of muscle cells. Thus, it prevents the muscles from fully relaxing. Next time you feel any discomfort moving muscles in your body, you might want to check the potassium level of your blood. Among all the weird symptoms of potassium deficiency, digestive discomfort is surely the most unpopular one. This is one of the reasons that people have found the correct reason for their upset stomachs lately. Actually, the digestive process is highly reliant on a balance of electrolytes, including potassium, to ensure smooth muscle contractions throughout the gastrointestinal tract. When the muscles in the intestines do not contract effectively, food moves more slowly through the digestive tract, resulting in hard stools and difficulty passing them. This can lead to discomfort and bloating. Another key aspect of digestive discomfort associated with potassium deficiency is constipation. Additionally, low potassium levels can also affect the function of the smooth muscle in the walls of the stomach and intestines, potentially leading to cramping and abdominal pain. Although digestive discomfort can be asymptomatic of some other underlying issues, ensuring an adequate intake of potassium-rich foods may help maintain healthy gastrointestinal function and mitigate these issues to a certain extent. One of the most serious symptoms of potassium deficiency is having abnormal heart rhythms, popularly known as arrhythmia. When potassium levels drop too low, a person develops hypokalemia, and it can influence life-threatening arrhythmia. In this condition, there is less potassium available for repolarization, which can lead to erratic electrical signaling within the heart. This disruption can result in various types of arrhythmias, such as atrial fibrillation or ventricular tachycardia. In addition to that, potassium homeostasis is one of the key players in regulating cell membrane excitability. The movement of ions, including potassium, across cardiac cell membranes regulates this electrical activity. This process allows the heart muscle to reset itself after each contraction and prepare for the next beat. If you are experiencing an irregular heartbeat, consult your medical advisor immediately. The worst-case scenario is that the person has a stroke. If you think that potassium deficiency cannot get any worse, then you might not know it all yet. It can even contribute to an increased risk of developing kidney stones. Actually, potassium is involved in the regulation of urinary calcium excretion. When potassium levels are low, the kidneys may excrete more calcium into the urine. High levels of calcium in the urine can increase the likelihood of calcium-based kidney stone formation. Moreover, potassium also plays a part in maintaining the body's acid-base balance. If there is a shift towards acidity in the urine, it can promote the formation of certain types of kidney stones, particularly uric acid stones. That's why people should be aware of potassium deficiency, as it can contribute to this acidic environment. Also, scientific studies have supported the link between potassium deficiency and kidney stone formation, especially calcium-based stones. For example, research found that low potassium intake was associated with an increased risk of kidney stones. To reduce the risk of kidney stone formation associated with potassium deficiency, it is essential to maintain proper potassium levels through dietary choices or supplementation when necessary. Thus, you can maintain urinary calcium balance and reduce the likelihood of stone formation. Potassium deficiency shows a wider range of various symptoms, and feelings of endless fatigue are one of them. Potassium deficiency can have a profound impact on energy levels and lead to persistent fatigue, a condition often referred to as hypokalemia. The intricate role potassium plays in various physiological processes within the body can explain this phenomenon. At the cellular level, potassium is crucial for maintaining the membrane potential of cells, especially nerve and muscle cells. This membrane potential is essential for transmitting electrical signals and maintaining cellular excitability. When potassium levels drop too low, as seen in hypokalemia, the cells become less responsive to stimuli, leading to a lack of energy and heightened fatigue. Furthermore, potassium is a key player in energy metabolism. It is involved in the conversion of glucose into ATP, adenosine triphosphate, the primary energy currency of cells. A deficiency in potassium can disrupt this energy production process, leaving the body feeling perpetually drained. The scientific evidence underscores the importance of maintaining adequate potassium levels to sustain energy levels and combat fatigue effectively. Keep in mind that there are many other factors that can influence fatigue. For example, a lack of calcium and suffering from depression often show similar symptoms. Hence, you must seek medical advice to find out the real reason behind your fatigue. And don't forget to keep your mental health in check as well. Potassium deficiency can have an impact on blood sugar levels, and the underlying science relates to potassium's involvement in glucose metabolism and insulin regulation. Even a lower level of potassium may be linked to a higher level of diabetes. In fact, potassium is crucial for the proper functioning of beta cells. Since these cells are responsible for producing insulin, and low potassium levels can impair beta cell function, one may experience a reduction in insulin secretion. Thus, it can potentially lead to hypoglycemia, also known as high blood sugar. Keep in mind that you need enough potassium in your body for many reasons. It plays a significant role in glucagon's activity, a hormone that raises blood sugar levels by promoting the release of glucose from the liver. Potassium deficiency can lead to imbalances in glucagon production, contributing to blood sugar fluctuations. Now you understand that potassium deficiency can influence blood sugar levels by affecting insulin function, pancreatic beta cell activity, and glucagon regulation. Although potassium is still not directly involved in building up type 2 diabetes, maintaining a healthy level of the mineral will help you manage your blood sugar level effectively. For patients with higher blood pressure, regular medication becomes a lifelong aid. Although there are multiple reasons for having BP on the higher side, one must not miss the possibility of potassium deficiency in their blood. Potassium and sodium are electrolytes that play opposing roles in blood pressure regulation. While sodium tends to raise blood pressure by causing the body to retain water, potassium has the opposite effect. Potassium helps to relax blood vessel walls, counteracting the blood pressure-raising effects of sodium. When potassium levels are insufficient, the delicate balance between these two minerals is disrupted. This imbalance can result in sodium's dominance, leading to increased fluid retention and higher blood pressure. Moreover, a notable study found that individuals with lower potassium intake were at a higher risk of developing hypertension, also known as high blood pressure. Is there any risk of taking potassium to anyone? While potassium is an essential mineral for most people, there are specific groups of individuals who should exercise caution or avoid potassium supplements without medical supervision. For example, individuals with impaired kidney function may have difficulty regulating potassium levels in their bodies and are at an increased risk of developing hypokalemia, elevated blood potassium levels. They should closely monitor the potassium intake. Besides that, some medicines, like spironolactone and other potassium-sparing diuretics, can change the body's potassium balance. People taking these medications should be cautious about potassium supplements and follow their doctor's recommendations. In addition to the conditions we have previously discussed, people suffering from Crohn's disease, chronic diarrhea, or gastrointestinal surgery may experience potassium loss. Moreover, those with certain heart conditions or a history of arrhythmias should be cautious with potassium supplements, as high potassium levels can disrupt heart rhythm. Also, elderly individuals may be at higher risk of potassium deficiency due to changes in kidney function and reduced dietary intake. While they may benefit from increased potassium intake, it should be done with consideration of individual health status. Athletes who engage in intense and prolonged exercise, resulting in excessive sweating, may lose potassium and other electrolytes. While replenishing electrolytes is essential, excessive potassium intake should be avoided. And during the pregnancy and breastfeeding phases, one must not take any supplements without consulting their doctors. Similarly, excessive potassium supplementation is not recommended without medical supervision for new mothers and soon-to-be mothers. As we've uncovered, potassium deficiency is no small matter. If you suspect a potassium deficiency, consult a healthcare professional for a thorough evaluation and personalized guidance.